Okay, hello everyone. This video, I'm going to talk about a form of natural contraception that's known as calendar method. So in this video, I'm going to talk about calendar method. So how a woman can follow a calendar and prevent herself from getting pregnant. Okay, so let's start with this. And before starting, we have to assume that the normal menstrual period in a normal female is of 28 days. Okay, so it starts with day 1 and then ends with day 28. So what is day 1? This is the first day of menstruation, means this is the first day where the bleeding has occurred. Okay, so the day when your bleeding starts, that is the day 1 of your menstrual cycle. All right, so after day 1, at around day 14, which is during the mid phase of your menstrual cycle, the egg is released from the ovary. Okay, so a new egg is released from the ovary, and this process is known as ovulation. Okay, so the process where the egg is released from the ovary is known as ovulation, and it occurs at day 14. Now, it's not the case in every female. In some females, the egg can be released earlier than day 14, and in some females, it can be released on the later days as well. Okay, so there is a range. So the range of ovulation can be from day 12. Okay, in some female, ovulation can occur in day 12, whereas in some female, it can occur as late as day 16 as well. Okay, so in this period between of day 12 of menstruation and day 16 of menstruation, the ovulation can occur. Okay, so ovulation means the egg is released from the ovary, and if the egg is released from the ovary, and during that period, if there is sexual intercourse and the sperm comes inside the female vagina, then there is a chances of fertilization. This that sperm can come into contact with this egg that has been recently released, and there can be fertilization. All right, so we need to prevent that for contraception. Right, so we need to avoid any sexual contact during this period. But that's not just it. Here, let's say in day 16, the female ovulates. Okay, so an egg is released at day 16, but the lifespan of this egg can be ranged from day 12 to from 12 hours to 24 hours. Okay, so this egg can survive even up to 24 hours, that is up to day 17. And also in some textbooks, they also say it can survive up to 2 days or 48 hours or day 18. Okay, so if the egg is released very late at around day 16, then it can survive as much as up to day 18. Okay, so up to day 18 also there is chances of fertilization if there is sexual intercourse. Hence this day 18 up to day 18 is also considered as unsafe period, means during this time if there is sperm, then it can fertilize the egg. Now coming back to day 12, let's say a female ovulates at day 12. Does it mean that if there is any sexual intercourse before day 12, there won't be any pregnancy? That's not the case. Okay, why? Because the sperms, the lifespan of these sperms is up to 5 days. So these sperms can survive up to 5 days inside the female body, which means if this female had a sexual intercourse at day 8, then the sperms that were released on day 8 can survive up to 12 up to this day 12, right? So if the female ovulates at day 12, if she releases her egg at day 12, then these sperms that were deposited inside the female body at day 8, the same sperms can fertilize this egg, right? And there can be formation of and the female can get pregnant. All right. So even this period before day 12 to up to day 8, this is also considered as an unsafe period. All right, because if the sexual intercourse takes place at day 12 and the sperm is released, and somehow if the female also ovulates at day 12, then there is a chances of fertilization. So this day ranging from day 8 up all the way up to day 18 of menstruation is considered as unsafe period, or in some textbooks it's called as fertile period, which means if there is any sexual intercourse, unsafe sexual intercourse between this period, then there is a chances that the female will get pregnant. Okay, so other than that, these remaining days from day 1 to day 7 and day 19 up to day 28, these are considered as safe period, which means if there is sexual intercourse, then the there is very less chances that the female will get pregnant. So the female can mark her menstrual period on a calendar. So let's say if she starts bleeding on day 1 and it was August, say 3, then August 3 is considered as day 1, and she has to keep on counting up to day 14. All right, sorry, up to day 8. So that is day August 11, right? So from August 11 all the way up to day 18, that is August, I guess it's 21. So August 21. So this period between August 11 and August 21 is considered as unsafe period. So if any unsafe sexual intercourse takes place between this period, then the female, there is a chance that the female will get pregnant. So that's the calendar method. Thank you.